Views expressed on this program are not those of intellectualradio.com, its subsidiaries, or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. Our topic for today is health concerns African Americans should monitor. We are live on Intellectual Radio. We just heard from Roman with the Drive at 5. Keep it locked right here on Intellectual Radio and allow us to feed your brain. Our quote of the day is, "The body achieves what the mind believes." We are grateful for our sponsors. Emanuel Church of God in Christ has a special message for you, so stay tuned and hear a word from our sponsor.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel Cogic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel Cogic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson. And we're from the Emanuel Church of God in Christ. We are building upon a solid foundation.
Awesome. Again, I am grateful for my sponsor. Make sure you catch them every Sunday morning at 10:15 a.m. Here are your trending topics for today. More than 485,000 people have died from the coronavirus in the U.S. There have been at least 27 million cases of coronavirus in the U.S., and at least 48,000 have died, according to Johns Hopkins University. So far today, they report that 5,265 cases and 78 of those have died. At least 70 million vaccines doses have been distributed, and 52 million have already taken the vaccine, according to the Center for Disease Control. Those are your trending topics for today. I'm really excited about the show today. I have none other than our Healthy Solutions expert with over 20 years experience. She is a physician impacting lives every single day. Hello, Dr. Michelle.
Hello, Lady ReShell. Can you hear me?
I can hear you loud and clear.
Awesome, awesome. How are you feeling today?
I'm good. Had to fight my way in today because of all of the snow. For those of you who are, in Chicago and the surrounding suburbs, it's really crazy outside.
It's nuts. I'm glad I could do the show from home for you today.
Technology. Thank God for technology. I didn't want you to miss the show today because it's a very important topic. We're talking about health concerns that African Americans should monitor. So if you are listening in right now, please like, share the show, invite somebody else in on this show. We all know someone who is dealing with some type of disease. And we do have Brenda. Hey, Brenda, thank you for tuning in. We also know someone who's dealing with these different diseases that we're going to be discussing today. And a lot of them we're not going to be shocked by because we've heard them over and over. But, it's really time for us to take action. So we're going to make sure that we give you something today that when you leave the show that you're able to take action with your health on today. So, Doc Michelle, where do we start to monitor some of these health conditions?
Yeah, well, it starts with us, right? It starts with knowing your risk factors for certain conditions and really arming yourself with the information to make the right choices for you. On the show here, we always talk about, being a health advocate for yourself, being aware, being educated, and knowing what is in your hands as opposed to your doctor's hands. I always talk about, hey, we've got lots and lots of medications and drugs that we can write for you. That's not our goal, right? Our goal, at least my goal, is prevention because it's a lot cheaper monetarily and for your health to work hard at prevention versus having to treat illness.
I like that you mentioned prevention. A lot of times, some stuff we don't even hear prevention. Like, I think about breast cancer where we hear early detection, but when we hear the word prevention, then we know that there's something that we can do. There's some type of control that we have in our hands that would make a difference. So that's why this show is so important today, because there are some things that we can do. All hope is not lost when we hear these different diseases. There are things that we can do to help us if we get the disease, how to deal with it, what to do. There are things that we can control. So I wanted to read these stats before you go, before you dive into the different topics. These are some of the most common health disparities between African Americans and non-Hispanic white Americans. So African Americans are 40% more likely to be obese, 60% more likely to have diabetes, 2 times as likely to undergo amputation as a result of poor management from diabetes, 40% more likely to die of a stroke, 30% more likely to die of heart disease, and 40% more likely to die from breast cancer, 2 times as likely to die from prostate cancer. Those numbers are high. So
that would be depressing, right? I mean, you hear those numbers and you get overwhelmed at the risk, the disparities with African Americans. But the thing is, there are things that we can do to change that curve, to lower those numbers. And I'm glad that I have this platform with you to really talk about that. You mentioned, heart disease, that African Americans are 30% more likely to die when they get heart disease. So there's a lot. We know that heart disease is the #1 killer of Americans, and that African Americans, as you just said, are more likely to die from that #1 killer. And so why is that, right? There's a lot of factors that go into that. We know that, there's certain risk factors, but which we'll get into, but even beyond the risk factors are these other social determinants of health, right? So are you even able to get to the doctor if you have heart disease to get it monitored on a regular basis? Can you afford your medications? What is it that makes us more likely to die if we get heart disease, right? So we're talking, you get heart disease, what are those risk factors, but why are we more likely to die from that, right? Is it we're not getting our referrals, right, on time? We're not getting those procedures early enough. And a lot of that piece comes from being aware that you can advocate for yourself, having providers that are able to really support our population. Just as an African American female physician, I think I was reading that only 2% of physicians are African American women, right? And so we have to also get more of us to medical school. That's a whole different discussion, so that when people go to the doctor, they see a familiar face that they trust, because there's also a lack of trust with the medical community and what you're willing to hear from your doctor because of that lack of trust and accept to do. So that's the other side of it, right? So the risk factors, yes, we can talk about that, right? High blood pressure, obesity, and smoking, and all those other things that are lifestyle changes that we need to address in our community as well.
Awesome. Mylea says, sadly, it's not normalized in our culture to eat healthier, exercise regularly go to the doctor. And it's, I don't know. And I know that we have this thing to where we really don't trust, the medical system because of everything that, our people have been through. But at what point do we change that initiative? At what point do we say, okay, look, people are dying, people are getting sick, and we necessarily don't have to if we do these things? Like, at what point do we change that?
Yeah. So those of us who are in a position to reach the masses, to talk to your family member or friend, or need to do that piece, right? Because how are we going to change the perception of and the reality of the past history that is now affecting us today? Is we got to start with each person, right? That's why I do this every month, because we have to change that perception. We have to also make sure that our community is educated and has advocacy for themselves, right? When you go to the doctor, if you're elderly, take someone with you. For those of us who are listening, have elderly parents or aunts or grandparents or such, go with them to the doctor, right? Because on some level, our elders, some will just listen to what the doctor says and just do whatever, or not do it at all, right? Without asking questions, right? And being an advocate for what you want. We talked about referrals being delayed in African Americans. We talked about delayed testing that occurs, and it takes educating the physician community to be sensitive to the needs and the level of literacy in our communities to be able to address those pieces, because there are things we can do. We could eat better, right? We talk about including fruits and vegetables. We can exercise more. We can get our cholesterol. We can work on those things. But then there's also the piece of, are you being heard when you go? Are you getting all the information when you go to the doctor? Are you getting to the doctor? Can you afford your medications? And that's where policy and insurance and all those other things, all those other pieces come into play.
So this has always been a question of mine. You know how when you get a prescription and then when you go to pick it up, they always give you the generic version of it. Like, are we being cheated getting that generic version because we are in the hood, versus if we lived in a different neighborhood, they would give us the actual, medicine and not a knockoff?
Right. No, I think generic medications go through, and they have to be approved by the FDA. So they go through the same sort of process and regulations as the brand name, right? So there's the one company that comes out with the brand name, and then after they have what they call that patent to be the only one that provides that brand name drug for so many years, then generics are able to come on the market. Those generics and how they are made is just as good and effective as the brand name at less cost for you. So don't think that you have to have a brand name. The only reason I would write a brand name prescription for someone depended on if they had an allergy to some sort of preservative or something in a generic medication, then because they tend to have different preservatives and things in them, then I would write a brand name. But for the most part, generics are just as effective as a brand name at lesser costs.
Awesome. Brenda mentioned and high cholesterol. We know that has a role in heart disease as well.
Yes, and in many things, heart disease, and I think we also talk about peripheral vascular disease, because high cholesterol, basically, you have the cholesterol that floats around in your bloodstream, in your blood vessels, and that quote bad cholesterol that we hear about is sticky, and so it sticks to your arteries and your blood vessels as it's moving through, and it causes blockages. So the more cholesterol that's floating through your system, that pipe gets blocked. So of course that then restricts blood flow to the heart, restricts blood flow anywhere, right? To any blood vessel. Your legs, when we talk about peripheral vascular disease as well. High cholesterol and high blood pressure can also increase the risk of erectile dysfunction. Again, blood flow anywhere. So the thing is, and the thing about cholesterol, it's not a problem that you're going to have symptoms from, right? It's not something that you would ever know you had if you didn't go to your doctor, right? But it causes these things that can be life-changing to you. And so we have to be proactive about what we eat to make sure that we're eating, plant-based diet, which we always talk about on here, right? And fruits and vegetables and nuts and grains and beans and all those things that are low in cholesterol, high in protein and fiber. That can help to lower your cholesterol naturally, because we also have people are concerned about taking statins, which is another conversation about any risk to your liver, which is rare and can be reversed if it's caught early. But that's another discussion. But so high cholesterol is very, very important, but you don't have symptoms from it. So it's important that you are seeing a provider, a doctor every year at least, to get those numbers checked. You hear that we talk about know your numbers. Know your numbers. One of those numbers is your cholesterol, your total cholesterol, which should be at least less than 200. Your good cholesterol, which should be at least over 30, preferably over 40, which is that HDL, and your bad cholesterol should be low. So I think about your LDL is your bad cholesterol, L for low. Your HDL should be high because that's your good cholesterol. And you won't know those numbers unless you go to the doctor. So then your doctor says you have high cholesterol, right? So now what? Because you're at risk for heart disease and strokes, right? Blood flow to the heart, the brain, the legs. You're at risk now. We were talking before the show about what can you do? You can naturally lower your cholesterol by exercising at least 150 minutes per week of vigorous exercise. So we think of that as 30 minutes 5 days a week, or 50 minutes 3 times a week, however you want to break it down. That naturally lowers your bad cholesterol and raises your good cholesterol. Isn't that great? So, for me that have high cholesterol in the family, heart disease in the family, I make it a point to get on my elliptical or do something about 3 times a week, because I know I've already been told that I have low to borderline high cholesterol. So it's important for me to do what I can so I don't have to be on a statin right now. At some point I may have to be because of my family history, but I delay that as much as I can by doing those lifestyle changes.
So there are things that we can do to help delay what's genetically, that was genetically given to us, that we can do to take control. And I know in my family, there are certain things that run in my family that you know about, and the way that you know is by talking to your family members about these things, about what's going on in the family, who has what, so that you can be aware of. And you can share that information with your children so that they can arm themselves when they go to the doctor as well. So if you're just tuning in, we are live on Intellectual Radio. I'm talking with Doc Michelle, and we're talking about how to monitor some of these health conditions that African Americans are diagnosed with. We have Tiff that's listening in. She says, yes, Doc Meeks, I love your spirit for educating, advocating, and helping others. Always great to hear you speak. And then we have Brenda who says, wow, thank you so much. So, this information, it really is life-saving, because a lot of people, sometimes they know what's going on, and sometimes we just sit back and we are just hoping that, nothing really happens from it. And then we see somebody who was dealing with it, and all of a sudden, they're hospitalized or they passed away. So don't be one of those people. You do have control over some of the things. So just whatever we're discussing today, if you know that these things run in your family, then you should be talking to your doctor to get whatever that baseline is for you, so that you know how to move forward and what plan of action that you and the doctor can take. One of the things you mentioned, Doc, was advocating for ourselves when we go to the doctor. So we really should be partnering with our physician, not just a quick in and out and you barely know each other, but really having conversations with the doctor to, let them know what's going on in your world. So, maybe if you're telling them certain things and, light bulb goes on in their head and they know, oh, okay, well, let's do this, or, maybe you can try this. But if we're not being honest and we're not being open about what's going on, then they don't really know how to help us. So,
Right.
advocate for yourself, but, be open and honest about what's going on.
Yeah, and when you say that, years ago I would say write down your questions for your doctor. Now I say use that the patient portal, because there's a lot of doctors, right, and the big healthcare institutions that have your patient portal. Go in there. I'll tell you, I have one. I access my mother. So anytime I have a question, I will pop it in there to my mother's doctor about, what about this medication and can we order this, right? And so those are things that it might be better even to use your patient portal for that, as opposed to just taking it to your doctor on the visit day, because you're right, they may be pressed, right? They've got 15 minutes, they're trying to get in and out. But sometimes if you can use that portal and let it be of use and benefit to you, you can put some questions there, right? So they already have that. They will sometimes get back with you within 24 to 48 hours, depending on what the situation is. Because we know when you go to the doctor, you've got a lot of things on your mind. They're pressed and things just don't happen like they should all the time, right? So if you're concerned about something, or if you are, like I think someone said, well, my doctor told me I had high cholesterol, well, what else can I do besides be on a statin? That's a good question to ask your doctor as well, because you don't have to, depending on the numbers, get on a statin right away. Have that conversation with your provider, but say, hey, because I would do this with patients. I'd say, okay, if you're concerned and you don't want to be on a statin right now, here's what we do. I give you 3 to 6 months, usually 3, because by then, if you're doing the right thing and I recheck the numbers, they should look better, right? Because you said you're going to do this, and then we're in a partnership. I'm not forcing you to be on a statin if you've already said to me, I'm really don't want to be on it, because what's going to happen when you go home with the script? Are you really going to take it? Are you going to take it every day? No. But if I build the relationship with you and the trust to say, all right, here's your shot. You said you're going to do it. I give you 3 months. I'm arming you with the information. Here's some diet tips. Here's what I need you to do. And we still don't see the results in 90 days. Let's talk about that medication. And they're like, okay, I'll give it a shot. And then I said, well, we'll start low on doses and all of that. We have that whole conversation. But there are things you can do and have conversations with your provider as well.
I'm sorry, I didn't think about the patient portal for that particular thing, to where you can, if something comes up, you can put it in there. So that way, yeah, when you go to the doctor, they already have looked it up, already have an answer for it. I didn't even think about using the patient portal for that. So that's good.
Yeah. I mean, yeah.
I've always
you can
just
ask questions.
Yeah, I didn't. Yeah, that's some good information right there. I didn't even think of that. So we talked about heart disease. We talked about high blood pressure. We know next is cancer, which is the number 2 killer of all races.
Mm-hmm.
And
yes.
And I can testify to, I was diagnosed with cancer. So now, just looking in my family history, my family tree, before I was diagnosed, I would never have even thought cancer ran in my family. So now when I sit back and look at that tree, because, they do the genetic testing, and they actually sit out and they draw the tree, and they'll put who had cancer on what side of the family to see if you even need to have genetic testing, so that I can arm my children to let them know that they may be, predisposed for this disease. So that's one of the things that we can do. If you have already been diagnosed with this disease, or you know somebody in your family that have been diagnosed, then talk to your doctor and say, hey, what are my chances of being diagnosed with this disease? You know, if my parents was, or my mother was, or my dad was, you know, ask those questions and see, you know, what course of action a doctor gives you.
Yeah, because, you know, something like breast cancer, yes, family history is very important, because we still don't know a lot about the risk factors for breast cancer, right? We think we know some things. Is it related to smoking? Is it related to aluminum in our deodorant? Is it related to what we eat? There's a lot of things, but, you know, we were talking before the show, that for breast cancer, early detection seems to be our best, you know, sort of way to at least catch it at stage 0 or stage 1. And so again, something that, you know, you have to advocate and get that mammogram. I talked to so many patients who just didn't want to have it done, but I tell them, you know, now they have better machines, and the digital comprehension of it is so much better. So it's not a painful event, right? So, and a little bit of pain for a lot of, you know, comfort and assurance, and knowing, you know, that you can move forward and you've taken control, right? Same thing, we talk about cancer and colonoscopies, right? People don't want to have a colonoscopy, but luckily now we have lots of other testing options for people who are at normal risk. So when we talk about colon cancer, colonoscopy is the gold standard screening tool, especially if you have a family history of colon cancer. Yes, we have Cologuard and, you know, checking for blood in the stool, which are great options if you are at normal risk. You don't have a family history, you don't have ulcerative colitis or other inflammatory bowel disorders, and you're at normal risk of colon cancer, then those other options are good options. But the gold standard is always colonoscopy, especially if you've had or noticed blood in your stool. And then we know that, getting back to that lifestyle, the risk factors for colon cancer, right? We think eating lots and lots of red meat, you know, and lack of exercise. And so, again, living that healthy lifestyle, we always go back to what can we do. But when we talk about primary prevention and secondary prevention, primary prevention is what do we do before you ever have the disease? Secondary prevention is now you have the disease, what are we going to do about it to prevent complications from the disease, right? So things like, you know, high blood pressure, yeah, primary prevention of high blood pressure, eat right, exercise, right? Secondary prevention is now that you have it, what do we do about it, right? Do we put you on medications? Do we continue to talk about these lifestyle changes? But with cancer, a lot of what we know about detection, even for prostate cancer, is detectable by these preventative measures and blood testing, right? We can find things. People ask, well, what are you looking for when we do blood work, right? We can see little changes. Are your white blood cells too low? Are they too high? Are you anemic when you shouldn't be? You know, so those are the things that raises, you know, the antenna of doctors. And then we're like, well, you're of this age and you're anemic, that you should maybe get a colon screening, right? So another reason that you should be seeing your provider on a regular basis to get those routine labs and screening tests done to decrease your risk. Because yes, we can talk about, you know, the risk factors for lung cancer and quitting smoking and all those things as well, but you've also got to see a provider to sort of check those things out as well.
I think for most people, it's probably just not the test itself, but the actual build up to it. Like for most women with the mammogram, it's really that build up to it. When you go in there and you take off your top and they give you the little robe and you're sitting in that room and you're waiting for them to call you back. versus the actual, okay, my breast is in the machine and they're taking these pictures, and then it's the actual, you sitting back in that room and you're waiting for that from them to read that mammogram and tell you, oh, you're okay, you can go, or oh, you need an ultrasound, we need to do further testing, oh, we need a biopsy. Like, I think it's like all of that versus the actual test itself. And the same thing with the colonoscopy is that, you know, the actual test, you're knocked out, you don't know what's going on, but it's actual, I gotta drink this stuff at home, and you know, and the actual, I'm going to the doctor, is the
talk themselves right out of it.
So true. It's so true. It's like, I'm not, that's just too much. It's very stressful. And then when you get to the doctor, your heart rate is elevated, and they're like, why is your heart rate elevated? Hello, I'm in here about to do a mammogram, or I'm about to do this colonoscopy. That's why my heart rate is so high. It's
anxiety provoking. It really is. And even as a physician, I'm like, oh boy, I got to make this mammogram appointment. I'm so nervous because what if, right? Everybody's thinking about the what ifs, but I tell patients all the time, I say, well, denial never cured anything. So denying that you could have something is not going to make it better, right? We got to know, because we, you know, just knowledge is power. Knowledge is key, but you have to know, because if being in denial is not going to delay the process that could be going on, right? So yeah, it is anxiety provoking. Even as like I said, as a physician, I have to talk myself into it, because it could be, you think, oh, this could be life changing, right? But it's what we have to do to take control of our own health, and what can we do, right? It's easy. As I tell patients, I can write your prescription and drugs all day. That's not what I want to do, right? That's to me, that's the easy answer. It's hard to change your lifestyle when you've been doing a certain thing a certain way your whole life. But we talked before about making small, easy goals that you, not so easy that you know it's going to be a piece of cake, but you think that you can actually reach, because the return on the investment will be great, right? If you say, I'm going to lose 10 pounds this month, right? And you don't lose 10 pounds, then what, right? But if you say, you know what, I'm going to start with my breakfast and I'm going to eat fruit and eat healthy, or, you know, and add, you know, egg whites, or add spinach to my eggs, or, you know, that's something concrete that you can do and make it happen. But in the end, you may lose that weight. But make the goal realistic and a short-term goal to reach the long-term goal. Because I think, you know, you could get frustrated and just fall off the horse and never get back on it.
I think it's important to make it a group affair. So don't, you know, you're not out there by yourself trying to make these changes, but pull somebody in with you that may have like similar things going on, or they may need to change some things, and then you hold each other accountable. And then that way you won't feel like, you know, you're out here by yourself. Because sometimes you'd be like, oh, I'm just giving up, because there's nobody there to tap you on your shoulder and be like, no, you got to keep going. So, you know, bring people in, make it could be a family affair to where, you know, you all are exercising and eating right and holding each other accountable. So you don't have to do it alone.
Yeah, I mean, we know that accountability partners work. Why do you think people go to gyms to exercise, right? Because they get support from the other people there doing the activity, and the trainers and all of that, right? So doing it with someone, but you got to make sure that person is going to stick with it, and it could be someone who has sort of moved through where you are, right? They were sort of in your place, but they made it through it, so then they can help you get through it, right? It's helpful to have someone in the same place that you are, but it's also helpful more helpful to have someone who's sort of gone through that piece to help motivate you that it is possible to get through that.
Yeah, it's always to help give you that hope. I totally agree. Kenya said this is very informative. It's very informative. I know we didn't get a chance to talk about diabetes,
yes,
which we know that there's different types. You have the pre-diabetic, you have the type 1 and the type 2. You always talk about, a lot of people don't even know that they have they have diabetes. And so you're walking around with all these things going on. And by the time you go to the doctor, you have, even especially with like the type 1, by the time you go, so many traumatic things have happened. But, you know, with type 2 diabetes, you can change it. It could be with your diet and with exercise.
Yeah. There are millions of Americans walking around that are pre-diabetic and don't know it, right? And so, and that pre-diabetes is really A1C less than 6, you know, more than 5, less than 6. But there would be no symptoms for that. Again, there's no symptoms for that for prediabetes. The only way you would know is when you go to your doctor, you have risk factors. Maybe you're obese, maybe it runs in your family, right? And they do the check and we see that. And then what do we do if you're pre-diabetic, right? Then we start talking about primary prevention of getting to diabetes, which really is, diet and exercise. And in some people who really do have high risk of diabetes in their family, we sometimes will put patients on medications to prevent them from getting to the next step. That's an individual sort of choice based on their other risk factors. But we talked about if you're pre-diabetic and you have a strong family history of diabetes, the goal is really to prevent you from ever getting to diabetes. But in some patients, the goal is really, you might develop full diabetes because you have a strong family history, but how long can we keep you in prediabetes or better so that you don't need to be on medication, right? Let's push that out as far as we possibly can. Hopefully you never need it, but we can at least push that out so you don't need to be on medication right now. And here's what you can do, right? Because with diabetes, you said that we're what did you say? 2 times more likely to undergo amputations, right, from diabetes, because diabetes causes damage to the vasculature and the nerves. In addition to it, you're also at increased risk of peripheral vascular disease. Those 2 things together can lead to this complication, but you never have to have your leg cut off if your diabetes is controlled. You can have diabetes for many, 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 many years and never get a complication. So it's not that we're afraid, right? We hear diabetes and we know family members or friends who've had that extreme, right? Who've had toes removed and legs cut off and eye problems and kidney problems. And all of that can be prevented if we take control of our symptoms and our diabetes early. I tell every patient, you have diabetes, but you never have to have a complication from it if we could keep it controlled. And it's hard. Diabetes is it's a horrible disease because every day you think about it when you're eating, when you're not eating. You're thinking about it. Is my sugar too low? Is it too high? What can I eat? What can I drink? And so you always, people will, in order to not think about it, they'll just forget about it, right? If you understand, and not take care of it because they get tired of thinking about it. I can't eat. What do I eat? My doctor told me to count carbs. What is a carb? And it gets overwhelming. And then you have to, but we have things to help, right? If you don't understand, and this gets back to advocating for yourself and asking questions, right? Maybe you didn't want to ask that question in the room when she said, you need to count your carbs. But maybe on your patient portal, you could ask her, can you give me some more information about carbohydrates, right? And she may send that to you. And so there's things that we can do now, right? We know diabetes can cause kidney disease and damage to your eyes and damage to the nerves and increase your risk of heart attacks and strokes. And it's an awful disease. So we talk a lot about lowering your risk. We also talk about access to care, right? Can you get to the doctor so you can get checked? Do you trust your doctor? Can you afford medications? All these things play a part.
I know with my daughter who's diagnosed with type 1 diabetes, they have her come into the doctor every 3 months. So, if something's going on, they're able to catch it really fast, or they're able to switch up the formula, of her insulin, to make sure that, it's working for her as she's growing into a teenager and, life gets busy, she's doing certain things. So, they do have educational classes that she can take, like nutrition classes, classes to get her off the shot and maybe put on a pump to where she doesn't have to necessarily inject herself.
Yeah.
So, there are things that, you can do to educate yourself better when it comes to diabetes. And I know she gets tired. She gets tired because she tells me, I'm tired. I'm tired of shooting myself. I'm tired. And I just tell her when she gets tired, let me know, let somebody else know so that I can give her the shot. She doesn't necessarily have to do it. But to never not go without the shot because her life depends on it. So you just have to make sure
diabetes is a family disease.
It is. It really is. Like instead of having her eat certain things or counting carbs, we're all going to eat the same things so that she doesn't feel isolated in what she's doing and feel like, I'm an outcast. What's wrong with me? I'm dealing with diabetes. She feels like she's the only one suffering. So yeah, it is. The whole family has to deal with it and help that person to get through it.
Yeah. Yeah. And that's your daughters feeling that way. Adults feel the same way too. It's and it's awful because I've heard it myself that, they want to eat what they want to eat, right? The rest of the family is eating this and I have to sit and eat this, right? So it becomes a family. It's really a family affair that everyone is going to eat healthier, right? And so that person doesn't feel the stigma of diabetes. If we're going to exercise, let everybody go for a walk, or eating better. So it is. And as far as doing the injections, important because some people just won't do it. I have had patients who just won't give themselves the shot, who wants to have to do that every day. And sometimes it does take getting the family involved, right? Are there grandkids? Are there nieces and nephews who can sort of play a part in this whole care of the patient, of the family member, to help keep them healthy?
Yeah, I always say that I think God actually prepared me for her going through diabetes and have to inject herself, because when I had the blood clots, I had to shoot myself in the stomach to, for the blood thinners to thin my blood. So it was like I had that practice before she was diagnosed, so that when she tells me, I don't like sticking myself in the stomach, I'm like, I know what that feels like because I had to do it. So, I know what it feels like, but you need to do it because, again, your life depends on it. Until they come up with something different, a different way for you to do it, this is the way that it has to be done. So you just have to keep that person encouraged. You have to, make sure that they know the importance of why they're doing it and that they're not alone, that the whole family is really helping them to deal with this. So don't make them feel like they are alone. Mm-hmm. So if you're just tuning in, we are live on Intellectual Radio, and we're talking about the different health concerns as it relates to African Americans. And we're talking to Dr. Michelle. We just got done talking about diabetes, and we know that really runs heavily amongst African Americans. And it's said that, people are being diagnosed younger and younger. Some of these diseases, we really think that they are older diseases, but younger people are being diagnosed.
Yeah, we used to call type 2 diabetes adult onset diabetes, but then we realized that younger and younger children and teenagers and even younger were developing diabetes. So now it's type 2 and not just adult onset diabetes, which is sad because we also know that 2/3 of the population is overweight or obese. And one of the main risk factors for diabetes is obesity. So I always say a lot of the things that we are dealing with in our communities can be affected by lifestyle changes.
So you said it's affected by lifestyle changes. So how do we change the trajectory of where this thing is going right now is by changing our diet and our exercise. I think we take those basic things for granted, like, yeah, it's really not changing anything, but realize that it's a lifestyle change, not like a quick diet, but this is something that you're doing every single day.
Yes, yes. I hate the word diet. I try not to use that word, but because it's really about making changes that are you can withstand for your life. Um, and you want to make the changes that you don't think it's just for a short period of time, but it's something that's sustainable, right? And so it really makes sense that a lot of the things that we talk about in the medical community are really based on lifestyle. But then the other pieces we talked about, right? How beyond the lifestyle, why is the lifestyle what it is? Right? We talk about, is there access to healthy foods in your community? Can you get fruits and vegetables in your community? Are they cost effective so you can afford them, right? Can you get to your doctor? So there's these other things. Is there safe walking paths in your community where, on a nice spring day, you could actually go outside and walk? So these other pieces, are there parks in your neighborhood that are safe? And what's the crime in your area? I mean, there's so many other pieces. We talk about the lifestyle, right? But what are the other socioeconomic factors that go into that policy changes will take, and changes in your local communities to get more walkable sidewalks and get more parks and those type of things that we may not think about as a part of the prevention piece. But if we're asking people to exercise, can they where they live, right? Are they able to do that?
Well, Kenya had a statement. She says it's very alarming that they have supposedly a cure for COVID-19, but not a cure for cancer.
Well, they have a vaccine for COVID-19, and hopefully everyone, when it's your turn, go get your COVID-19 vaccine. So we have a vaccine for that. Cancer, it's so it's such a difficult thing, because every cancer has its own sort of genetic makeup, right? And so it's hard to say I'm going to get a vaccine against cancer. Our best bet is early detection and prevention right now for cancer, and for other things like infectious things like the flu and COVID-19 and other infectious things. Yes, we have vaccines for those. So I wouldn't call it a cure necessarily. Call it a vaccine, which will give you immunity, very good immunity to this virus, to get us through this pandemic, which we've talked about many times on the show as well.
Well, we know that they have we talked about last week, the HPV vaccine. That's one that would help protect you against cervical cancer, certain cancers. So we know that they are working on a vaccine for cancer. But again, like Dr. Michelle said, there's so many different types of cancer that there would have to be a lot of different types of vaccines when it comes to cancer, or as Kenya will put it, different cures when it comes to cancer. So it may work for some different ones, but then the other ones are still out there that, that they really have no idea like where it comes from. So how are we going to make a vaccine or cure when they don't even know? They have no idea.
And HPV is a virus that happens to cause cervical cancer. So again, we have vaccines to viruses and infections. We just don't have a vaccine for cancer yet, for the multiple types. But the people in the oncology sphere are doing awesome work to help people live longer who have certain types of cancers, and they do great sort of innovative therapies. So that's the good news. You know, even going back to COVID-19 and scientists, listen, I have all praise for scientists that work in that field, finding vaccines and cures for things. Though they do a lot of great work.
And we know that the mortality rate for cancer, certain cancers, have went down tremendously. So, you know, it's a scary situation when it comes to cancer, especially when you are African American, because especially with breast cancer, we're 40% more likely to die from breast cancer. So here we go.
Yes, because exactly. So early detection is key. And then if you unfortunately are diagnosed with cancer, make sure that you have conversations about what are my options, get second opinions. I mean, there's some studies that show that African Americans get referred later for chemo than other, white counterparts. So if needed, we want the best treatments as well, right? So making sure that, first of all, early detection, do those things that we can, and then do your research, do your homework. I always say with patients, right, if you have a health condition or something you're concerned about or something new diagnosed, take someone to the doctor with you. It's impossible for you to remember everything and take it all in by yourself. I remember when I was in medical school, they said that by the time you leave the room, the patient has forgotten 50% of what you said. And by the time they leave the office, they forgot the other 50%.
That's true. I remember going to the doctor, and I would take my mom with me. Every time I went, my mom would be in the room with me because I know for a fact that I was going to forget everything that they're saying. All right, Dr. Michelle, you are frozen. So if you want to go back out and come back in. Kenya, you mentioned that's a very high rate. Which rate were you referring to? Were you referring to the breast cancer rate with the 40% are more likely to die from breast cancer? We know that we don't get diagnosed more as our white counterparts, but we know that when we are diagnosed, for some reason, we tend to die more. And like Dr. Michelle said, it could be because maybe we're not getting referred to the different services that, we're supposed to go with, like chemotherapy, radiation, or even surgery. But I know that when it was time for me to do chemotherapy, my doctor was so fast to refer me for chemotherapy. Like, she was ready. As soon as I was diagnosed, she was like, all right, let's get a plan together. I met with my nurse navigator, and she was on it. Like, I was like trying to delay it, but she was like ready. Let's go. Even when I was in treatment, I remember having a fever, like 103. And like every day they run your blood, they check to see if you have a fever. And she was like, I don't know if you're going to have treatment today. And she was like, I'm going to push you through. You're going to do it. We're not going to break treatment. Let's go. And so, I really think it all depends on where you're going, who that doctor is. Even when I didn't have enough money to do my Neulasta shot that I had to take after chemo. I needed it. My copay was $100. I'm like, I don't have that. My doctor said, give her a shot. She has to take it. To her. So, and that's why it's important to have that relationship with your doctor so they can advocate for you so that you can get the things that you need so you can get that treatment in a timely, effective manner because your life depends on it.
Yes. That's a powerful story, right? Because once you are diagnosed with cancer, the quicker you start the treatment, the better. Unfortunately, during COVID, things have gotten so delayed, right? But as quickly as you can get started on treatment. And I've had friends and patients ask about natural things, right? I said, do your natural thing along with your chemo. Okay. So anti-inflammatory diet, your plant-based diet, meditation, positive thinking. I mean, all those things we know help, but don't forego our great medical treatments, especially when it comes to cancer. especially we talked about lifestyle for waiting for cholesterol rechecks and all of that. That's a whole different ball of wax. But when you're talking about cancer treatment, the quicker, the sooner you begin, the better. But certainly do those other things, right? Eat your healthy foods, get that anti-inflammatory, all your colorful fruits and vegetables, and and get the dairy out your diet, and all those other things that can help your body heal and do what it needs to do better while you go through the other medical treatments.
Dr. Michelle, there are some facts and myths out there when it comes to African American and our health. One of them is African Americans aren't as engaged in their own health.
Not true at all. I mean, we are engaged, but there are other factors that affect our ability to get the adequate services and treatments, and the socioeconomic factors and all those things matter. Education of our community matters. Having role models and great relationships with our healthcare community matters. So it takes all of us doing our little pieces to have them move into the healthcare system in a productive way and be supported when they get there.
Awesome. Another fact or myth is the health insurance will fix the problem.
No, it will help. It will help, right? That's why we've got the Affordable Care Act, because we know that there are millions of people that just don't even have insurance. So that is definitely key. But then, can you afford the insurance? Can you get to your doctor? Are there doctors in your community? Again, can you fix can you afford your medications? Do you have walkable places in your neighborhood? I mean, insurance is a piece to the puzzle for sure, but we have to also address those other factors and those social determinants of health as well.
Okay, this one should be easy. Fact or myth, African Americans are predisposed for certain health conditions.
Predisposed in that we are at risk for certain things. Genetics plays a part, but all those other things that are also important, right? So our history of how we eat, exercise, all those other things put us at risk, but not just predisposition because we're African American, right? But the other factors that increase our risk then show at the end of that, yeah, we have more percentage of these disease states. But again, what are all the factors?
Exactly. Give us some words of wisdom as it relates to health concerns that African Americans should be monitoring.
Yes. So I think we mentioned earlier, know your numbers, right? So simply know your blood pressure, know your cholesterol numbers, get your lab work done so you can have discussions, with your provider. So that is a main piece of us being proactive in our health. And so when you talk about that one thing, I said, be proactive, take control of your own health, and do those things that you've heard us talk about on multiple shows. Start small with little goals. Think about what it is for you that you want to change, and set realistic short-term goals that will give you a good return on your investment and keep you motivated.
Awesome. Thank you so much. As always, you have delivered your gems. So I appreciate you just sharing your wisdom with us as it relates to African American and our health. Thank you so much. We did put a link in this particular post, so you can click the link and you can take your own quiz on heart disease, correct?
Yes. You will be able to assess your heart disease risk. It's from Mayo Clinic. You put in some certain information about your weight and any risk factors and family history, and it will tell you at the end of that what is your heart disease risk and what you can do to start making some changes. So definitely click on that. It's in the post.
Awesome. So you have been given your homework to do that will benefit you. Again, thank you so much, Dr. Michelle. I appreciate your wisdom.
Oh, you are so welcome. It's always a pleasure to be here with you.
Always. I will leave you guys with these words of wisdom. You only fail when you stop trying. So join me next Monday right here at 6 p.m. on Intellectual Radio. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.